Thank you for tuning in today to our webinar on compensation for lab result notifications during no-shows. My name is Jeff McKay from Brightsquid. With me today is Mark Eyre, our Director of Customer Operations. Mark, thanks for tuning in today.
Hi, good afternoon, everybody.
So we're going to dive through, and so the quick agenda here, we're going to talk about improving patient well-being with secure mail communications. We're going to talk about the codes that fall under that type of communication. Mark's going to take us through a secure mail templates demonstration because we're really framing this discussion around making this process easy. I'm trying to work in a number of the questions that we get from clinics. How do I communicate with patients in a way that's supportive of patient well-being and still qualifies for that compensation, so that we're not giving all our time away for free and in a way that makes sense. So let's kind of just dive through there, and I'll talk about the ways that clinics are improving patient well-being. And I will point out, sort of before we get too deep into this stuff, this information is coming from us. This is a result of conversations we've had with clinics that are doing these things, that are billing for secure mail use. We've talked to lawyers, we've talked to Alberta Health, the AMA, about how these codes are meant to work. So we're sort of presenting that. And obviously this is not the final word on how this stuff works, but we'll go through the interpretations, what the rules are, and how it's being applied, and how clinics are using these codes now. Clinics work with patients every day, and clinics work with all their patients, and patients only work with their clinics. So in a patient's mind, they're only thinking of themselves. They're worried about the test they just got yesterday or last week, worrying about what the results are going to come back as. And letting them know what's come back can help improve patient well-being, patient satisfaction, and even patient outcomes. Patients in Alberta now have access to their lab results. I myself use that service, and I know hundreds of thousands of other patients do. I think there's almost 700,000 patients on that service. And conveniently for both patients and your clinic, secure mail is integrated into My Health Records. So if patients log in and look at their most recent results, they're posted there and shows a normal range typically, they can message you with questions they might have. I know there was some concern when MHR was launched from clinicians, and I think rightly so. Patients are going to go on there, they're going to see the results. They don't have the expertise to interpret those results, and they don't have the expertise to interpret those results necessarily in the context of their own situation. So it's important for clinicians to provide that guidance. Hey, you have access to this information. Here's what that means for you. And secure mail is a great tool to get that done. It helps improve health literacy, right? We're giving patients information to be more engaged and make informed healthcare decisions. It actually improved communication, does improve patient outcomes, and it'll reduce phone traffic, right? I've certainly been the patient who calls the clinic saying, hey, what's up with that test? When are we going to hear back about that? Or, if I have a question, I have lots of cases where I just need a simple answer from my clinic, and it took 8 phone calls back and forth. Secure mail can also improve access to care on both sides, from a clinician standpoint, a clinic standpoint, as well as a patient standpoint. There's lots of research about secure mail communication, secure messaging. The average time for a clinician to send a message to a patient is 2.3 minutes. And I think even the top quartile of that study showed that at the longest, clinicians were taking about 2.5 minutes. So it doesn't take long. It's a great way, and we'll talk about it again, a great way to replace some phone appointments, some phone traffic to the clinic, because you don't have to worry about the conversation getting away from you and taking more time than was allotted. Let's talk about the health service code. So secure mail messages to patients are billable under the conditions of a 301F, which is physician to patient secure electronic communication. You can, send 14 bill for 14 of those messages per calendar week per physician in your clinic for medically necessary advice or follow-up to patients that you've seen within the last 12 months. So anybody who you have an existing relationship with, really, you should, and it makes sense, discuss and agree to the limitations of using electronic means. So, if you're having chest pains at 11 o'clock on a Saturday night, secure mail is not the thing to use, right? Pick up your phone and dial 911. If you have questions for the clinic, certain clinics have different ideas about how they do this. And templates is actually a great way to set that up. We have thousands of templates now set up in Secure Mail, Mark, I believe, and many of them are set up to be patient invites. So when you're inviting a new patient, and it actually lists out, here's the things that we'll use Secure Mail for, and here's what we'll expect you to use Secure Mail for, as a way to kind of establish that relationship. The service must inform patients when the physician is unavailable. Mark's going to show you some ways to accomplish that inside your account. You can't see the patient in a visit within 24 hours following the message. And then the response prepared by the physician is provided to the patient. So the physician has to prepare the response to a patient question or the advice. And Mark's going to show you what that looks like. And it may not be claimed when the service is provided by a physician proxy. So, if the physician is the person seeing the patient and the nurse says, here's what your results mean, that doesn't work. But if the physician is composing the message or preparing the message or says, hey, this is what I want you to tell the patient, then, from lots of different perspectives, that fits into what you need to do. So it's not to be used for simply forwarding results. So if you get a PDF off of Netcare or cut and paste it or take a screenshot or something and said, hey, patient, here's your results, that's not billable. There needs to be interpretation. And that was, like I said, a lot of the discussion that was had going back to when MHR launched and Secure Mail, the Secure Mail integration came into it. Lots of questions from clinicians saying, yeah, but there's interpretation to be done. And that's where the medical advice comes in. Booking appointment in response to a patient question. So a patient sends in a picture of a rash they have on their arm, and you write back and say, we'd like you to come in and get that looked at. That's not billable. Receiving patient questions isn't billable because you're not providing any advice. And communication is not secure. So you need to use a service like Secure Mail. You can't send something to a patient's Gmail account or send something from your Outlook, even if it's what is it called? Microsoft encrypted Outlook, right? I think that's what they call it. That's not always secure. And I would say there are clinics and organizations that use that service. It's a really bad experience from a patient perspective. If you've received a Secure Mail message, it's pretty easy. We've tracked what happens with Microsoft encrypted Outlook. It takes 5 to 8 clicks and tasks to get to a message. You got to download stuff, you got to open files, you got to request a password, and if you want to come back and access that message again, you have to do that process all over again. So it's really not helpful for patients sending things that way, and that's why Secure Mail is meant to be so much easier. We do get a lot of questions because clinics say, hey, yeah, I know I can bill for communication to patients, but what would I ever communicate to patients in a Secure Mail message that would qualify as medical advice? Lots of stuff. Kaiser Permanente in the US does a ton of virtual care. And what they've seen is that 83% of their instances of virtual care are done through a secure messaging system. 16% is done by the phone, and 1% is done by video. So the big rush to video at the start of COVID, we all kind of saw how that doesn't work because there's a lot of technology challenges with that. Phone's a little bit better, but the problem is that it's synchronous. Messaging, clinics can send a message, and like it says here in the first point, it's billable if not answered. So when we're talking about doing things during no-shows, I know a lot of clinics, if someone doesn't show up for the appointment, the physician has a little bit of time in their schedule. Hey, why don't you call this patient, see if we can get a hold of them, and then we can address that issue. And that's something we can use. We can fill that time slot with something where we get some compensation for a time and meet our targets. If nobody answers the phone, that time is not well spent. Sending a Secure Mail message, once you click send, that message is now delivered. You can go in later and check and make sure that it was read using read receipts, but now you know that this activity is billable, and it takes 2.3 minutes instead of the 5 or 6 or 25 minutes that it takes to have a phone call. You don't have to worry about potentially falling behind on your schedule now because you're stuck on the phone. You can address questions following diagnosis. So patients might find out that they've got a chronic condition they didn't know about, and a week later they've been thinking about it, they've got some questions that pop up that can be sent in, and those can be answered. I will say that any message thread, so this is once per patient per week. So if the physician responds and the patient writes back and the physician responds, that's still only billable once. So just to be careful about that kind of stuff and aware of it. Providing advice, treatment for simple concerns, things like dermatology, like I suggested. Someone's got a simple rash and they just need to put some Vaseline on it. That counts for sure. And then, monitoring and adapting chronic care. We see a lot of physicians using it in this way, especially during the pandemic. People didn't want to travel. They didn't want to come in. Hey, how are you doing? Send us your results. Send us your latest readings. What's your blood pressure? And adjusting to that, responding to that, giving advice based on those inputs, and really improving access to care. We get a ton of feedback from patients who are grateful to be able to send questions to their clinic outside of regular office hours. And the clinics that are able to or willing to respond either during a set period of time every day or every week. Certainly do have clinicians who do respond to patient questions at a certain time. You think about any physician that's working with an expected mother. We know that some clinics do say, hey, during the weekend, you can write the doctor will answer your message if something's coming up. And what's great about asynchronous communication, we don't have to worry about people missing appointments, not answering the phone, technology issues. We've had feedback from patients who say, I had to travel 2 hours to get to my doctor. So for patients distributed over a broad geography, it's great. It's often easier to send a secure email message in areas where cell phone service might not be good, where a voice call might not be appropriate. When patients are, for example, frontline healthcare workers that are working 12-hour shifts, they can't answer the phone all the time. They only have set breaks. They can send a message on break number 1 and maybe look at the response in break number 3. So it really does help improve access to care and support people who aren't always able to get into the clinic. I want to talk about how this all adds up. So if you do the math here, it's a significant impact to your clinic. So if we're looking at just 0301S, it's a $20 code. You can send 14 a week. If you look at that times 4, it's about $1,100 a month. If you multiply the weekly by 52 months or 52 weeks, sorry, it's actually $14,500 additionally per year if you're taking advantage of this code fully. And then eConsult Request is another code. We didn't really talk about that, but it's a different service. And we've done a webinar about that. It's on our website. If you go to the Clinic Innovators section on brightsquid.com under the Secure Mail tab, you'll see that we've got quite a good webinar about eConsults with a number of interviews with physicians who use it. So it's the ability for you to send a question to an expert in a field or a specialist asking, what should I do with this patient? What do you think about this presentation? Rather than referring that patient outright. It often helps you get response or a course of action much sooner than you would if you straight out referred that patient, as the referral might not always be necessary. And a referral is not billable, an eConsult request is. You have to do it over a secure system like Secure Mail. I've talked to clinics who say that doing 10 of these a week is easily doable, especially during no-shows. If you've got the information assembled, you can put it in, attach the files that you need to have. Here's what, hey, Dr. Reynolds, here's the information I have. I have questions about this patient. Here's what they are. What do you think? And that's actually, the response is billable as well. And there's some rules around that. So I'll direct you to the fee navigator to take a look and see, what they are there. But when you add that on top of the patient communication, you're getting about an additional $30,000 a year. Now that's using your no-show time wisely. It's billable. You're not smiling and dialing, hoping someone picks up the phone. You're actually doing impactful work that helps improve patient well-being by accelerating care, improving access to care, improving patient satisfaction, right? Helping them relieve some anxiety by saying, hey, your test results came back. They're normal for you. Here's some additional notes. If you have any questions, call us and you can come in, or we'd like to repeat the test in a couple months, and we'll see what that looks like pretty soon. So talking about Secure Mail templates, and Mark, feel free to chime in because you talk to clinics every day who are using these. Secure Mail templates, a lot of communication in healthcare is standardized, right? We say the same things over and over again. We use a lot of similar kind of documentation, and we can reduce hours of typing every month. I have talked to clinics who are literally saving a day of staff time every month that they can use for better things just by not retyping messages over and over again. So those clinics that are sending just a couple hundred messages a month, which is fairly standard, and they're saving 2 to 3 minutes per message, and that adds up pretty quick. You standardize and can have standardized and consistent communication. So you know that when you're talking about a certain condition or sending instructions for a certain procedure, that it's the same every time. We're not typing different words, trying to think about what to say. We're not using short forms for words that look unprofessional, because a lot of times these are part of the patient record, and that's not part of the legal record that the patient has access to anytime. You want that to be clean and professional. Streamline communication with patients and other clinics. Just select a message and hit send, or personalize it a little bit more to the context of the situation. And, looking back to, professionalism, eliminate spelling mistakes. This is why a lot of clinics actually use templates, and they don't allow staff or clinicians to send messages that aren't templated. Sometimes you need to, but for certain communications, and certainly a majority of it, that can be templated. So, Mark, if you want to sort of seize control here, I know you've got some things prepared so that we can dig in. And
all right, to Jeff's point, I want to cover a lot of things in the next 10 minutes. I'm going to go pretty quick here, but one of the first things I want to talk about is the actual creation and management and editing of templates. Now, as Jeff mentioned, we have thousands of templates available. What he really means by that is when you log into your Brightsquid account and go to the settings tab and select templates, there'll be a handful, not thousands, but a handful, 3 or 4, I think, different templates that you can choose from. Those different templates are customizable by you, the clinic administrator. So you can make as many different custom templates as you like. And as Jeff said, that allows for more consistent communication from everyone in your clinic. So it makes training staff a lot easier. You don't have to worry about spelling mistakes or grammatical errors and things like that. And when a new staff member comes on and you need them to do certain tasks, you can just tell them, go into Brightsquid and send John Doe the template regarding cholesterol tests or what have you. So by the thousands of templates that Jeff alluded to a few minutes ago, what he's referring to is the fact that of our thousands of clinics that are using Brightsquid Secure Mail, those clinics have created their own sets of templates, and there's thousands of those. But you won't see all those on your list. Those are somewhat private per clinic, but you can create them as you need to. All right, so I'm not going to create a template right now. It's fairly straightforward. It's really just like composing of any other message. You can just save it and reuse it dozens, hundreds, thousands of times. But I want to go back to the specific workflow and use case that Jeff was talking about, which is, when I have a moment, and whether it's during a no-show or at the start or the end of my shift, it's relatively easy for me as a clinic MOA or even a physician within a clinic to send out secure mail messages by using the templates feature. I don't really have to type much. I can just point and click and send a few messages. So to illustrate that, I'm logged in right now as a office administrator. I'm not actually acting as a physician today, but I've been instructed by my physician to carry out this activity. Now that instruction may have come through the EMR, or maybe the doctor is just standing behind me. I was going to say whispering in my ear, but that sounds weird. He's just standing behind instructing me on what message to send. So let's go through that workflow. So I need to send a message to my patient, Adam, with regards to his, let's use cholesterol test results. So I'll address the message to him as I always would. And in a manual activity, I could just type the response here. But I've pre-created a custom template called cholesterol test results. And when I select that, it automatically populates the message with dear recipient name, and that'll be populated with Adam's actual name when he sees the message. And you can see the actual message that we've written there. Now, use your imagination. You can use whatever test results are appropriate in your clinic. I just chose cholesterol test results because that's a fairly obvious one. I reviewed your results. They're normal. No changes required at this time. We should repeat this test every 6 months. If you have any questions, let us know. Now, that's all from the template. I may want to put in a little private or personal note there to add more information, like, don't forget your vitamins. There we go. And I can just add that to the template just to add more information. Now, I'm going to go ahead and send this. And so that's all done. Now, I wasn't timing myself, but that was about 30 seconds. I don't know. Now I'm going to switch the point of view. So we just sent this as Clara, who is the office administrator at Dr. Fauchard's office. So if you'll bear with me here for one quick second, it doesn't take very long. I'm going to change my point of view now and change my hat from medical office administrator to patient end user. So for those of you that have never actually seen the patient interface, this might be somewhat revealing. And you'll see that it looks a lot like what you see. So the secure mail system doesn't really vary that much from doctor or provider side to patient side. So I'm going to log in now as Adam. When I log in as Adam, I'm going to see the messages that I've recently received. Now, one thing you'll notice, and if you are seeing the patient side for the first time, I'll just point this out. When a patient gets a message from the clinic, it'll often say, in this case, this message here from August 11th about his gingivitis, must have been a medical message or a dental clinic. You can see that the message came from the Fauchard clinic. And then this name in brackets is the person who sent the message at that clinic. So this came from my doctor's office and Clara was the sender. Compare or contrast that with this other message regarding skin tags that was also sent from the Fauchard clinic, but it was sent by the doctor, him or herself, in this case, himself, Dr. Pierre Fauchard. Now, the message that I just sent a few seconds ago when you all were watching me were the cholesterol test results. That's the one I've been waiting for to find out if I'm going to have a problem. And so you can see here that what I've received now has filled in the patient's name. It's also filled in the sender's name down here because that was part of the template where it just automatically filled in that it was sent by the Fauchard clinic. So from the patient's point of view, this message comes from my doctor, and the actual hands on the keyboard were a staff member at the Fauchard clinic, and that's just fine. What I also wanted to show you is this message that I received from the doctor himself. Now, one of the things that we talk about a lot, especially in the Brightsquid secure mail training seminars, is the use of the shared inbox. And not to get too much into that, but the whole concept of the shared inbox is the patient, generally speaking, is communicating with the clinic and not a specific person within said clinic. But when they receive a message from the clinic, like this one, for example, it's coming from a specific person. So there's a certain level of human connection there. But one of the things that may be less obvious is users like Dr. Fauchard here can send messages to the patient, but it can be a one-way street, so to speak. And by that, what I mean is this message was sent to me by the doctor himself, but when I, as a patient, reply to it, very interestingly, the response is going back to the clinic. So this frees up Dr. Fauchard from having to deal with hundreds of incoming messages from every patient, because when he sends a message to a patient, it comes from him, but the response through the magic of Brightsquid gets routed back to the shared inbox where Clara or Wayne or Bob or whoever else works at the clinic can take care of that message that comes in from the patient. So it just allows for a little bit more communication that may not be that you may not have been aware of, and that's what I wanted to show you today. So Jeff, I think that's pretty much all the time I have for my section of the presentation. Was there anything that you think I should go back over and show in more detail?
No, I mean, I think if it's easy to switch back into the settings and just show that checkbox,
Absolutely. So
where you can actually turn it off.
Sure. So everyone buckle your seatbelts. I'm going to quickly switch back to the point of view to that of our office manager. So now I'm back to Clara. And what Jeff's referring to is the settings configuration, which allows each individual user under their own personal settings to determine whether or not they want to receive messages directly from patients. So in this case, I'm logged in as Clara Barton right now, and Clara has the option turned on that allows patients to message you, that is to say me, directly. If I turn this off, as is the case with Dr. Fauchard, when the patient attempts to address a message to that person, it'll just be automatically routed to the shared inbox instead. And that configuration is available at a personal level, so each person can manage their own settings, or the clinic administrator through the clinic members tab can set everyone's settings to have those different values. So here's Dr. Fauchard. If we take a look at his settings, you can see that the option for patients to message this user is already turned off, as Dr. Fauchard has already made that setting on his own. So there you go.
Perfect. Thank you. So that concludes our presentation today. We do have a couple questions. I'll go point out before we get into those. You can request a SecureMail playbook if you're still looking for ideas for ways that you can message patients, how to use SecureMail in your clinic. We've worked again with clinics throughout the province and beyond to come up with some simple ways you can use SecureMail and show a step-by-step for who's involved in what process. So here's this particular start point is done by staff, or here's what to do when a patient messages you, or that kind of thing. And it's a really step-by-step approach for a number of different things. And it does kind of take a deep dive into templates as well for getting them set up, edited, deleted, all that kind of stuff. A couple quick questions before we sign off here. We do have one question about EMR integration. So at the end of this month, we will be having another webinar all about our appointment reminder service. So Brightsquid is launching secure appointment reminders. There's a couple of clinics trying it out now, and that is integrated into TELUS Health MedAccess and PS Suite. So you'll be able to react automatically to your appointment schedule with secure appointment reminders to send patients things like instructions prior to appointment, questionnaires, history questionnaires, you know, if you want to do your COVID-19 screening, that kind of stuff goes there. If you'd like to have us mail you, old-fashioned mail, a copy of the playbook, just get in touch with our support team at support.brightsquid.com or give us a call, and we'll get that sent out to you. The other questions we have, additional cost. There is no additional cost beyond your regular subscription of $39.99 a month to use SecureMail with patients. If you're a free user clinic, all you have to do is upgrade, and you can take advantage of these codes by messaging your patients. You could already take advantage of 0301R with existing clinics. If you want to invite other clinics that aren't already on SecureMail, but in Alberta, there are, I looked this morning, just over 1,200 medical clinics that have SecureMail accounts. So take a look in the directory. You can search clinics by name. Mark's point about people who send messages, their name showing up. What we've found is patients frequently look for their doctor in the directory rather than the clinic name. So some clinics haven't set up all their clinicians in the service. And that means patients aren't really finding you when they search, and then they give up and they move on. So if you want to be able to communicate with patients, have patients find you and take advantage of this service, having patients message you so you can respond to them or have them send you questions because they looked in MHR. Make sure that your clinicians are set up properly so they're searchable in the directory. And then if you don't want them to get the messages directly, have those come to the clinic. Make sure you uncheck that box Mark just showed us. What if patient doesn't read the message? Well, again, sending the message is what's available. You can go and see if the message wasn't read in the read receipts by going to your sent folder. If you know that you want the patient to make sure that they see, you can prod them again to read that message and maybe give them a call. And then the last question was about managing messages to doctors. So we've covered that. Thanks, Mark. Yeah, that brings us to the end. Thank you so much for tuning in. If you have any questions about setting up SecureMail in your clinic, give Mark and his team a call. That's the number, 1-800-238-6503. Like I said, and Mark said, we work with hundreds, actually thousands of clinics to find ways for SecureMail to be implemented in your unique situation. So we're full of ideas. And if you have any questions, give us a shout. Mark, thanks so much for your time and that demonstration. That was very helpful.
Well, thank you. You know, something just occurred to me, Jeff, while you were talking now about finding my doctor on Brightsquid. I know my doctor's name, but I do not know the name of the clinic he works within. I can find it on a map. I could drive there, but I don't know the name of the clinic. So it's helpful that I can find him by name when I look him up in the Brightsquid directory. And
that's a good point. And one of the things that we see a lot of is that either clinics don't put in their proper name, or patients don't know their proper name. So, you know, West Springs Family Medical Clinic might just be called West Springs Medical,
Yeah.
or vice versa, right? And the patient's going to type in the short form, and that doesn't show up in the directory search, but they're more likely to get their doctor's name right. So that's really important.
Exactly.
Great. Well, there's no more questions popping up. Thank you so much for your time, and enjoy the rest of your week. Thanks, Mark.
And long weekend. Bye, everybody.
Yes.